AM 1060 WMEL.
Information Overload with John Harper, Saturdays at 4 p.m. on AM 1060 WMEL.
The views expressed on the following program are those of the hosts, callers, and guests, and are not necessarily those of WMEL staff, management, or advertisers.
Good afternoon, everyone. My name is Kay Kaiser with Helping Seniors of Brevard. I am very thankful to be able to sit in for our president, founder, Joe Steckler today. Stay tuned. We've got a wonderful show. And before we get into the actual format of the show, I want to remind everyone what Helping Seniors of Brevard is all about. Our mission is to improve the quality of life for seniors by providing information, which is what we're doing here on the radio arm today, education, as well as on the radio's program here today, and access to resources. So my official title is the Information Specialist for Helping Seniors of Brevard. I take those calls and I do my doggone best to try to give those callers the resources that they're so desperately looking for. Understanding that a lot of the seniors in our community may not have access to a computer, so they just don't have a clue where to really turn to get much needed resources. And believe me, those callers sometimes are looking at a pretty desperate situation and they need some help quick. So our mission is to try to help put them in touch with the resources that they so desperately need. So before we start our program today, I would like to give a special shout and thank you out to some of our partners that make the radio arm of Helping Seniors possible. We'll start out by Aldea Today, Barbara McIntyre, who's a home equity retirement specialist. She specializes in reverse mortgage, folks. We just added new articles in the Barefoot Bay Tatler. So we're now reaching into the southern part of Brevard County. We want to also welcome Brevard Chiropractic and Injury Center and also Neurogenics Nerve Center of Rockledge, Canadian Meds of Melbourne, Cobblestone Real Estate, which is known as The Waters, Courtney and Braswell Financial Group, Ebony News Today, Ear Care, Handy Pro of the Space Coast. So if you're not familiar with that business, what she does is she tries to help people live in a very safe environment by providing special modifications to the home to prevent falls, etc. And congratulations to her because she recently completed her general contractor license. So Hometown News is also a wonderful partner with us. In-Home Personal Services, one of our newer partners. Kindred at Home, Levin Home Care Nurse Registry, and Organized Creative Designs. We'll get back to the second part of our partners in the other portion of our program today, but that last sponsor that I mentioned, don't let that name fool you. Organized Creative Designs, Miss Carla Pickerel. Her background actually is an RN, so she has a special interest in observing seniors that she visits, but her specialty with her company is to help seniors get organized and many times just plain downsize. So she'll go out of her way to make sure that if a senior selected a specific location, whether it be independent living, assisted living, etc., she will take the precautions to measure the furniture and to lay it out in what's necessary to take and not to take. So without further ado, I want to give a warm welcome to our guest today, Mr. Lance Jarvis. Welcome, Lance.
Thank you, Kay. Happy to be here, and a special hello to our listeners.
Fantastic. Now, Lance Jarvis, you are one of the area coordinators for SHINE. And I think right off the bat would be a good idea. You know, SHINE stands for
Serving Health Insurance Needs of Elders.
Fantastic.
And SHINE is part of the Florida Department of Elder Affairs. And we have 35 counselors here in Brevard, all volunteers, serving Brevard citizens at 12 locations throughout Brevard County.
Phenomenal. And they're all volunteers.
All volunteers, very, very well trained volunteers. It's not easy to become a SHINE counselor. so that the training is extensive. They must have, we give them lots of experience before they are allowed to work on their own as a counselor. So these are folks you can trust. These are folks who want very much to help seniors make good decisions about their health insurance.
Excellent. So everyone that I have referred to Shine always comes back, and I had a call just the other day tell me that, oh, I went to go see a Shine counselor, and she went on and raved about expertise and taking the time and the compassion that individual showed, that she says, I'm going to tell everybody about Shine. So, I hear those kind of comments a lot, Lance Jarvis.
I'm always thrilled to hear that, Kay. Our counselors, all volunteers, are doing this because they really want to. Really want to help seniors. They have a passion for what they're doing, but it's always great to get the feedback that they're doing a great job. I certainly hope they are.
Oh,
Always.
they are. They are excellent. And I go way back even before working for Helping Seniors of Brevard for a retirement community. And we had a lady that came in. I can't remember her name. She's no longer working with you, I believe, at this time. But she would always fill the room with a lot of residents who really needed to learn more about what services are available to them.
Yeah.
It's hard to navigate.
Medicare is hard to navigate. It's a very complex system. As a matter of fact, it's just a little bit over 51 years ago that President Lyndon Johnson signed the legislation that created Medicare. And every year since, Medicare has changed a bit. So there are lots and lots of changes that are always taking place. In a system that's already complex, and it's our job to stay on top of those so that we can answer questions for our clients and help them to select health plans for themselves that meet their own special needs. Our counsel is completely free. It is totally objective and unbiased. We don't sell anything.
That's a very important point, Lance Jarvis, because many people, when they get solicited from many numerous insurance companies all the time. You're a senior, we need to be looking at this plan, and everybody's coming on, and it's probably, I would think, very overwhelming for a senior to understand.
It sure can be, Kay, and many of our clients come to us after having attended several seminars offered by these health plans, and come to us and say, I was hoping I would get a straight scoop, but now I'm more confused than I was before, and so I really need help. And that's where, of course, we're there to help, and we're delighted to be able to do so, either in person at one of our offices, or else by telephone. We're very happy to talk to counselors by phone.
Okay.
And it's important to reassure the listeners that anything that is shared with a Shine counselor is held in the strictest of confidence. It goes no further.
That's an important point as well, because you're not going to be having someone sit down in front of you or by phone taking information that's personal, and being able to share that with someone else. I mean, that would be scary in itself. So by stating that, Lance Jarvis, I think that anyone listening to the program today would rest assured that that information is going to stay with that counselor and not any further.
That is correct, Kay. It certainly does. And our counselors have more training in the privacy rules of HIPAA.
I was going to say,
chances are that we have more training than your own doctor does. So speaking to us is very much like talking to your doctor, your attorney, or your accountant. Nothing leaves the room.
And the neat thing about it, it's totally free.
Oh, it's completely free.
So a lot of people may have a misconception, Shine, I'm going to go see Shine and I'm going to be charged this, but that's not the case.
Never a fee. We charge nothing. And we're grateful for the support we get from the federal government. Provides a little bit of support, and that's given to the Department of Elder Affairs.
Okay.
And it's divvied up among various areas within the state.
Excellent.
So we have the counsel is completely free. It's wonderful. It's a wonderful program.
You know, it's all about information, Lance Jarvis.
True.
And, you know, going back to our mission statement with helping seniors of Brevard, we had an initial survey, as you're aware of, because you sit on our advocacy council, and it pretty much tied up for number one. The response was education information.
Yes.
It's, you know, when you think about an insurance plan, be it Medicare, you're probably, the first estimate is when somebody approaches 65. How soon do you, recommend that they actually look into Medicare as they're approaching 65?
Well, that's a great question, Kay. I recommend that people speak to us months before they turn 65. 5-6 months would be fine.
Okay.
Because there are a lot of decisions to be made concerning how you're going to get your Medicare benefits, whether it's going to be from original Medicare and a prescription drug plan, or on the other hand, a Medicare Advantage plan. And those are very, very different ways to get your Medicare benefits. And it often requires that the person that we're counseling give it some careful thought.
Absolutely.
And then before they make any further decisions, we may meet with them a second time. And then, if depending on which path they choose, whether it's original Medicare or a Medicare Advantage plan, we can then help them choose specific plans.
Okay.
Now, it's important to point out that we don't make decisions for the client. Rather, we show them the pros and the cons.
There you go.
And just as you said, we give them the information to make a good decision. And we do that by listening to what their concerns are, what benefits they're seeking from their health insurance. And with that information, we can help narrow down the choices and give them some comfort that the choices that they can select from are all going to be reasonably good ones for them.
And for their benefit, definitely. Each individual is different.
Each individual is different, and the decisions are complex. For example, there are 17 Medicare Advantage plans in Brevard. 17.
Wow, I didn't realize that many.
There are over 20 different freestanding Part D drug plans. And when it comes to Medicare supplements or Medigap plans, there are 10 different plan designs that Medicare has created, and each of those plan designs can be offered by as many as 40 different insurance companies.
Wow.
So it just pays to come to Shine.
Yes.
Excuse me. And let us help you navigate through the Medicare maze. It's complex, and we have lots of background, lots of insights, and we can share those with you and help you to make good decisions.
Well, that's very important, Lance Jarvis, and I think that probably, is there a central number that you would like to give to our listening audience that they may want to take note of here today?
Yes, Kay, I'm glad you asked. The best number for Brevard County is area code 321-752-8080. And let me repeat that.
Thank you.
321-752-8080. And when you call in, you may get an answering machine, and we check those messages daily, and we route those calls to counselors throughout the county. Normally a counselor that is close to your residence. So if you wanted to stop by the office, we're assigning your call to a counselor who serves at an office that's near your residence.
So how many different locations do you have in Brevard County now for someone to see a Shine counselor?
We have 12 locations at this time, and they they go all the way from Titusville to Palm Bay. We have several offices on Beachside, We have offices in Rockledge, Melbourne, Satellite Beach, 12 offices. We're in Vieira.
Okay.
There are offices throughout the county, many of
Excellent.
which are at public libraries. So the
Right.
libraries are normally located close to folks, and we use space in the libraries as well.
Excellent. Excellent. So when somebody's in there maybe just trying to get on a computer, they can make arrangements to see a shine counselor.
Sure can.
All right.
Sure can. Okay. Yes.
Fantastic. Well, I think a lot of people may or may not understand, Lance Jarvis, the difference between Medicare and Medicaid. You know, they get confused on that. So could you elaborate and differentiate the two for our listening audience today?
I sure can, Kay. I'd be happy to. Medicare is health insurance that is offered through the federal government, either directly from the federal government if you have original Medicare, or Medicare is also offered, Medicare benefits are also offered through Medicare Advantage plans, which are plans offered by private insurance companies that have a contract with Medicare.
Okay.
So that is that's Medicare. It consists of Medicare Part A, which is hospital insurance, Part B, which is medical insurance, Part D, which is prescription insurance.
It's kind of like an alphabet soup there.
Yeah, it kind of is. Then Medicaid is assistance offered by the state of Florida to Medicare beneficiaries who have relatively low incomes and relatively modest amount of financial assets.
Okay.
And the Medicare, Medicaid programs are designed to help defray some of the costs of your medical care.
Okay.
For example, many of the Medicaid programs will pay the Part B premium, which is this year is about $122.80 for anybody who's new to Medicare. So what we do in as Shine counselors is help to pre-qualify folks, ask them the sorts of questions that help us to figure out whether they should apply for that benefit through Medicaid. And if they are, we have the applications normally right with us to complete, and then they send them off to the Department of Children and Families, which determines whether or not they will get the benefit.
Okay.
Another program that we help to qualify people for, pre-qualify, is a program called Extra Help. Extra Help is a program offered through Social Security, and Extra Help provides prescription drug benefits that include possibly a totally free Medicare prescription drug plan,
Okay.
and very low co-payments for the drugs that you get.
Right.
So one thing that we always do is determine whether or not a client qualifies for some additional benefits that they may not even be aware are out there.
See, Lance Jarvis, that's an excellent, excellent point, because by mere virtue of just coming to see a Shine counselor, if they try to do it on their own, they may be up a creek, per se, in the fact that missing so many of these other benefits.
Yep, they will be making many, many phone calls and have many disappointments in trying to get that information, whereas if you come to a Shine counselor, you'll get that information right on the spot.
That's excellent. Well, if you just tuned in, my name is Kay Kaiser. I'm the information specialist for Helping Seniors of Brevard, sitting in for Joe Steckler here today. and my very special guest, Mr. Lance Jarvis, who's an area coordinator for Shine. And if you didn't catch that number, we'll bring it up again that he mentioned, but for anyone wishing to call Helping Seniors of Brevard, whatever resources that you're looking for, Shine is an excellent resource. As you've been listening and learning today on this radio program, just pick up the phone and call 321-473-7770. If I'm on the other line with another caller, leave a message because I promise I will return your call. So again, that number for Helping Seniors is 321-473-7770. We're about to take a quick break here, so stay with us. We've got an excellent Part B of our Medicare program today.
Great.
Thank you, and stay with us.
AM 1060 WMEL, your home for the Florida State Seminoles.
Welcome back to the second part, Part B. I should say no pun intended. I meant to say that because we were talking about Medicare today, and Part B is certainly one of those options.
Sure is.
My name is Kay Kaiser. I'm the Information Specialist for Helping Seniors of Brevard, sitting in for our President, Founder, Joe Steckler today. But before we get into our second portion of our program, I'd like to mention special thanks to additional partners that have joined Helping Seniors of Brevard to help us continue to do what we're doing. One being exactly what we're doing today is an outreach media via the radio. So let me give a special thanks to Riverview Senior Resort, Senior Scene Magazine, Senior Care Brevard, Dr. Lee Sheldon, Spotlight Magazine, the Eye Institute, the Fountains of Melbourne, Veterans Realty of Brevard, Vitas Innovative Hospice Care of Brevard, Watercrest Senior Living Group. That's going to be a new assisted living memory care by the name of Market Street Memory Care Residence, opening up next month. Bill Johnson, and board certified elder law attorney. And of course, a special thanks to WMEL AM 1060, which is where you're listening to live on the radio today, Wusthof Health System, and Zon Beachside Assisted Living. So without further ado, let me get into reintroducing our special guest today, Mr. Lance Jarvis, who's an area coordinator for Shine. And maybe somebody was driving down the road, they didn't actually get a chance, maybe they pulled over, they didn't understand. Let's reiterate, if we could, Lance Jarvis, what Shine stand for?
Sure, Kay. SHINE stands for Serving Health Insurance Needs of Elders. And SHINE is part of the Florida Department of Elder Affairs with 550 counselors throughout the state of Florida. We're all volunteers. There are 35 or so of us right here in Brevard County. And we serve our clients either by phone or at 12 locations throughout Brevard County, from Titusville south to Palm Bay.
Okay, excellent. Lance Jarvis, let me ask you a question. I just happen to think that, how long have you been participating with Shine?
I'm into my 7th year, Kay.
Wow,
and
okay.
Each year I enjoy the work that I do more and more.
Oh, that's fantastic.
It's a thrill and an honor to be able to have a Medicare beneficiary or a soon-to-be Medicare beneficiary come into the office with questions and confusion and an unhappy look on their face because they are so distressed over the decisions they have to make. And as they're about to leave, I see a smile on their face, their shoulders are relaxed.
Yay!
And I feel it's all worth it. It's a great feeling to be able to help folks.
Oh,
and I know that's true for all of the volunteer SHINE counselors who work throughout the state and here in Brevard County.
Well, hats off to all of the Shine counselors because you are certainly serving a need, a much needed service. And Lance Jarvis, I have to comment, the fact is that I wake up every day and I take the attitude, I wonder how many people I can help today.
Isn't that great?
Yeah, it's such a rewarding feeling, and so many people just say thank you for taking the time to speak with me. As recent as yesterday, I had a lady call about one thing, and as I get to talk to her a little bit more, she starts telling me, oh, I need this too, and oh, I was unaware of that. So, that information is so vital. It is so vital.
It's vital, and when we can help people get the information they need and direct them to the appropriate agency to get the assistance they need,
it makes it all worthwhile, doesn't it?
Makes it all worthwhile. It's a wonderful feeling. Wonderful feeling.
We're speaking to Lance Jarvis here today, an area coordinator for Shine. My name is Kay Kaiser. I'm the information specialist with Helping Seniors of Brevard. And if anyone who is looking for resources, let me give that number out to you here again. It's area code 321-473-7700. Again, 321-473-7770. So, Lance Jarvis, let's talk about it a little bit. Coming up in the not-too-distant future, it's called an open enrollment period. What exactly does that entail?
Kay, it's a great question, and it's one that all Shine counselors are thinking about because Medicare's annual open enrollment period is the busiest time of year for us. It is the one time a year that Medicare beneficiaries can make a variety of different changes to the Medicare plans that they have.
Okay.
And so it gives Medicare beneficiaries an opportunity to think through what their needs are going to be for the coming year, how they may have changed since last year, and explore the different ways in which they can get their Medicare benefits for the coming year in a way that best meets their anticipated needs for 2017.
To project that out a little bit, because no two people are the same. And you brought an important point out, Lance Jarvis, the fact that, what may have been good last year may not be particularly the best of their best interest in the coming year, correct?
Sure, Kay. Lots of things happen from year to year.
Sure.
Our health can change.
Absolutely.
Our prescriptions may change.
Right.
Our medical conditions may change. And one thing that I must emphasize is that the plan that you have this year, whether it's a Medicare Advantage plan or a prescription drug plan, it will not be the same in 2017 as it is this year. These plans change annually in various ways. Sometimes it is to the beneficiary's benefit, but very often it is not.
Uh-oh, okay.
And one
That's
of the
important.
saddest phone calls that a Shine counselor can get after January 1st, when the changes to plans go into effect, go something like this. I just went to the pharmacy and a prescription that I've been taking over the years is no longer covered by my prescription drug plan.
Uh-oh.
Well,
Trouble.
that's trouble, and it could have been avoided.
Yes.
Because we know, starting on October 1st, what prescription drugs every one of the 20 prescription drug plans will be covering for next year.
So let me ask you this, Lance Jarvis. If someone simply just doesn't do anything, and they say, okay, well, open enrollment, I'm okay, I'm not even going to bother doing anything. A lot. Do you find people that do that?
Oh, yes.
Okay.
Too many do.
That's what I'm afraid of.
The example that I just gave you of the person who found out the wrong way.
The wrong way is right.
That their
Ouch.
prescription drug plan no longer covers an important medication. They could have known that, and they could have done something about it.
Right.
So if you do not do anything, and you're not required to do anything, you're not required to make any changes, the plans that you have now will be carried forward to 2017 with whatever changes that plan has chosen to make from year to year.
Right.
So the plan may have made changes, but you will still be in that plan.
But unbeknownst to the individual, if they don't really take time to look at the changes that happen annually, as you gave that example, Lance Jarvis, that can be a pretty devastating impact.
It can, Kay, and it's very sad when that happens, or when a client calls and says, I have the same plan I had last year, now that it's 2017, but when I went to my doctor, I found out the doctor is no longer taking my plan. What can I do? Well, I'll tell you what you cannot do, and that is, it's too late to change plans.
Oh boy.
So you are stuck with that plan for the balance of 2017.
That can be a financial burden for a lot of people in that case.
It can, and can be a big disappointment to somebody who's found out they no longer have the same doctor participating in the plan that they kept, whereas if they had switched to a different plan, they might have been able to keep that doctor.
That could have been prevented.
So,
yes.
One of the things that we do as Shine counselors is make sure that you ask those sorts of questions.
Yes.
That you call the doctor's office. If you're in a Medicare Advantage plan, find out from the doctor's office directly whether they will be continuing to be in that plan in 2017. And of course, we have a number of other questions that we ask the client to be sure that whatever decision they're going to make will be the right decision for them, whether it's a prescription drug plan or a Medicare supplement or Medigap plan or a Medicare Advantage plan.
Okay. But you're giving so much more information that they may not have had any clue to by simply asking those questions to that individual.
Yes.
Okay, that's very important.
It sure is.
Very important.
It sure is, Kay. And something else that I find disappointing is that on or about the end of September, September 30th, October 1st, October 2nd, anybody who's in a prescription drug plan or a Medicare Advantage plan will get what is called an annual notice of change.
Okay.
The annual notice of change is required by Medicare to tell people who are in that plan what will be different next year.
Interesting. So pay attention to that.
But most people don't read it. And so they don't, the annual notice of change would have told them that the drug that they're taking is not going to be covered next year, or it will be covered, but on a much higher co-payment tier than it is this year, which means more money out of your pocket.
Of course.
So many people just look and see, well, my premium is about the same, or it's going to go up, or... That's hardly the only question that you should be looking to answer when you read the annual notice of change, because there can be many changes that you need to know about and in making a decision as to whether to retain that plan for the coming year.
So folks, if you've just tuned in, that's a very important point that Lance Jarvis, he's an area coordinator for Shine, volunteer in this case, as all the Shine counselors are, because by working with a Shine counselor, he and his associates, his team, are going to bring out those pertinent questions and points to your attention because, as you just pointed out, Lance Jarvis, many people do not even pay any attention to these letters they get in the mail, and it can be devastating for them.
It can.
Yeah.
So let me emphasize, Kay, that the annual open enrollment period for Medicare runs from October 15th through December 7th.
Okay, not till December 31st. It's December 7th.
Yes.
A lot of people might think it's till the end of the year they have.
Yeah, many years ago it was December 31st.
Is that right?
And,
Okay.
Try to reach somebody on December 31st at an insurance company that you wish to change.
Forget that.
So December 7th is the final day to make changes, and any
Okay.
changes that people do make become effective on the first day of January in 2017.
Okay.
And I think it would help too, Kay, to share with folks what changes they can make during the annual open enrollment period.
That's a good point.
'Cause
Yes.
There are many
Yes.
changes that are possible.
Right.
For example, a person who has original Medicare can change to a Medicare Advantage plan.
What's the difference between the two of them, if we can help explain to our listening audience?
A Medicare Advantage plan differs from original Medicare in that a Medicare Advantage plan is a plan offered by a private insurance company
Okay.
under a contract with Medicare.
All right.
And it may not offer any fewer benefits than original Medicare offers. But it's important to emphasize that Medicare Advantage plans use networks of physicians, hospitals, and other medical facilities.
Okay.
And many of the Medicare Advantage plans are HMOs, health maintenance organizations. And you,
Not a PPO.
no, not. There are a few PPOs also.
Are there? Okay.
But most of them are HMOs.
All right.
And it's important that people know or recognize that if you use a facility or a physician that's outside of the HMO network, the HMO has no obligation to pay.
Okay, that's an important
That
point.
would be, you would
Absolutely.
end up stuck with the bill, except if you have a medical emergency anywhere in the country. You have a true medical emergency, just go to the nearest emergency
Right.
room. The Medicare Advantage plan will pay for that.
That's a different situation.
Yes,
Under an emergency situation.
under an emergency
Okay.
anywhere in the country.
Okay.
So one thing that a person can do is switch from original Medicare to a Medicare Advantage plan,
All right.
or vice versa.
Okay.
A person with a Medicare Advantage plan says, you know, this just isn't it just isn't right for me. I'd like to get back to original Medicare.
All right.
They can do that. People can switch prescription drug plans. If you have a freestanding prescription drug plan, a Part D plan with original Medicare, you can change that prescription drug plan very easily.
Good. Good.
If
good.
you have never signed up for a Part D prescription drug plan, you can do that also during Medicare's annual open enrollment period. The one thing you cannot do is enroll in Medicare if you didn't do so during the times that you were eligible to enroll.
Okay.
You have to wait until after January 1st to sign up
All right.
for Medicare.
Okay. Again, this is information that our listening audience, it's valuable information because many people, at 65 and over, you've got the access to Medicare, and if you don't pay attention to it, as Lance Jarvis pointed out, you could be looking at, oh my goodness, I didn't realize this. So Lance Jarvis, let's give the listening audience here again, if we may, that main telephone number, because you've got various locations throughout Brevard County that they can dial. So pick up your pen and pencil here again. Here we go.
Okay,
All righty.
Here it is, folks. The main Shine number in Brevard County is 321-752-8080. Now, if you have a computer, Another way to find a Shine office is to go to the following website, www.floridashine, all one word, floridashine.org. And that lists every Shine office in the state of Florida.
Excellent.
And you can easily find the ones that are in Brevard County, the days they're open, the hours they're open, in that way. So either way, you can get the information you need to get in touch with Shine.
Well, Lance Jarvis, area coordinator for Shine here. This information that you've given today is extremely important for people to pay attention to because, as you mentioned, we've got less than 2 minutes here with the show, but as you mentioned, that pay attention to what you've got now and what you may be needing in the future. And again, as he said, that main number is 321-752-8080, or you can go online to www.floridashine.org.
Exactly.
So there's a lot of good information and the education of trying to get this information out. So with all of that we've talked about today, I want to give a special thank you, Lance Jarvis, for being our guest. It's been a real pleasure to speak with you, and your insight and knowledge, what you have up there, and that cerebral is amazing.
Well, thank you very much, Kay. It's always a pleasure to be here, and it's a privilege to share the stage, so to speak, with your listeners today.
Absolutely. Thank you so much, and thank you for all listening to Helping Seniors of Brevard. We'll see you next week.